I'm a medical doctor by training, and I have a master's on health policy and management from Harvard. I also worked as a health policy advisor for one of the health ministers here some years ago. I do some consultancy work for 2 African countries, Somaliland, and lately I have started to help the country of Benin. And I do research on neurosurgery at Children's Hospital Boston. I am here to talk about what we can do to help Kosovo's healthcare system reform. And the motivation behind that, in the first place, is that in my case, almost every week, there are people who contact me in Boston to help them with somebody from their family, somebody who is not having treatment here or needs tertiary care services not provided here or in the region. Also, as part of my health policies training, we have seen a lot of reforms going on in Eastern Europe, and many countries have successfully reformed their healthcare systems, and Kosovo is lacking behind. It's not something we cannot do. It's something actually that we could do and we should do. That's for the sake of our people, of our children, and everyone who needs health care. So now, if we look at the situation in Kosovo, the status of the health of the population, basically Kosovo has the poorest health indicators in all over Europe. We have the highest infant mortality rate, and also we have the shortest life expectancy. Infant mortality rate, based on UNICEF data, is twice higher than our neighboring countries. Also, there are no data, accurate data about what's the rate of post-infectious infections, post-operative infections, but they are reported to be pretty high based on some pilot studies, which haven't been replicated. So now, also, the economy in Kosovo is not that good. Actually, we have the lowest GDP per capita in all over Europe. So the budget that is available from general taxes is not that high to support a substantial development of healthcare. So I will be discussing about ways and means, how we could improve the situation, and these are problems and issues which many other countries went through, and they managed to overcome. For example, countries in all the Eastern Bloc, post-communist countries, like Estonia, like Czech Republic, like Slovakia, even Croatia, Hungary, they all reformed their healthcare systems in the last 2-3 decades, and they are stories of success. Their life expectancy went up, and basically all healthcare indicators went up. So we could use those examples of success for Kosovo too. In addition, there are international grants and opportunities for Kosovo to reform its healthcare system should the institutions of Kosovo make very good project proposals and prepare an action plan regarding the needs that are in the country. So here are some of the issues and problems which I put in a diagnostic tree. That's something we do in health policy to diagnose the healthcare system. And some of the actions plans, these were not typical only for Kosovo, but in different shape, perhaps also in other countries, and they were overcome. And I will be discussing about the 5 key components of Kosovo's healthcare system, actually any healthcare system. That's the financing of healthcare, the payment system, organization of healthcare, and then regulation of healthcare, and lastly, it's the ethics and behavioral issues. So now we will discuss a little bit about, basically we won't be able to cover every single issue, but just very briefly some of the key, most important things. The financing of healthcare system of Kosovo is done from general taxes, and actually the budget is about $110 million for the whole public sector. That was based on Kosovo's Statistical Institute of 2013. And that's way too little to cover the needs and the operational costs of 1 university clinical center, 7 regional hospitals, and the rest of the primary care centers of the whole public system. So Kosovo doesn't have health insurance schemes. There is no distribution of the financial risk, which means you get sick, All the financial risk is on you. And also, there are hardly any capital investments in the last 25 years. There is no investment in the tertiary care training and technology, and Kosovo has been lacking behind. As a consequence, we all know that thousands of patients every year need to go abroad for treatment. And that, in addition to the financial costs, has also visa limitations and is time-consuming. And quite often, a lot of families must sell their homes, all what they own, to be able to cure a family member. From an economic point of view, this leads to the impoverishment of those households. And if we have thousands of families a year which get impoverished, that also influences Kosovo's economy. In addition, when we have critical conditions that are time-sensitive, we may end up in a situation with a fatal ending because visa is delayed or the paperwork is delayed. So people of Kosovo are at risk for not being able to receive their healthcare services at home. Another issue is the payment of Kosovo in Kosovo's healthcare system. All payments are done on salary basis, which means if you are a hospital employee and you treat 10 patients a day, you are paid equally compared to the other doctor, which is has treated 100 patients a day. So that form of payment should be changed. And also, there is some participation, also co-payment, which is basically collected locally but managed by the central government. And quite often, administration doesn't collect that money. So there must be a reform also in the payment system. And basically, one of the first things in finances is we must have a health insurance scheme in place. In that way, we distribute the financial risk, and the healthcare budget will be increased by 2 to 3 times based on the situation of the economy, the number of employers, and employees. Also, the payment system should be able to include pay for performance and should include peer reviews of the colleagues, because in that way we motivate good behavior and good clinical performance. Another thing I wanted to talk about is basically the structural organization of Kosovo's healthcare system. The system is heavily centralized. When I was a medical student here before leaving to the United States, administration people told me that sometimes even for printer paper, the Ministry of Health had to decide. This takes a lot of time, a lot of administrative people's work, and it delays the whole process. We should be able to decentralize the system, which means that we transfer authority and responsibility to local institutions over most of the things, but we maintain accountability to the central government. At the same time, managers, due to a lot of the political influences and the whole system, how it has been set up, managers have very little decision space, and this influences their decision, influences their way and means to be able to make a good performance at work. So we need to be able to do those structural changes which give managers more decision space. We translate in the United States decision space as the possibility to hire and to fire whenever necessary. If a manager sees a good employee, a rare talent, he should be able to hire him. In case he or she sees a very lazy employee who doesn't perform, the manager should be able to fire him or her. In that way, we are able to basically focus on the performance in a hospital setting. Another thing which I wanted to basically focus is as part of the decentralization. So it shows a triangle of accountability, responsibility, and authority. In case we decentralize the structure, it doesn't mean that, let's say, a local hospital in Peja or Jakova can do whatever they want. They should be at all times maintained accountable to quality, in particular, the way how they treat the employees, how they manage the public finances, and so on. I wanted to talk also about the regulation. A lot of things which happen in Kosovo, they are not properly regulated. There must be done much more work to be able to regulate by law, applicable law, all the things that happen in the healthcare sector. And at the same time, something which is critically needed in this country is the Code of Medical Ethics. Why is that important? Well, with the Code of Medical Ethics, we regulate the behaviors of both medical doctors, of the nursing staff, as well as the administration. And the Code of Medical Ethics must be specific, not a generalized overview of how things go, but for specific procedure, specific case, how do we do, and what's the applicable legal application to that. I believe that an ethical framework also in a country like Kosovo should be able to include the universal healthcare coverage as part of the health insurance schemes, but at the same time be able to provide equal treatment for all Kosovo citizens, regardless of any background. And this, in that way, will assess and will be able to regulate relations in a working place like our hospitals. Another very important thing for this country, in my belief and analysis, is the quality assessment and monitoring, in particular in the private sector. We should be able to have an agency in this country which is independent of the political structures and would report directly to the parliament and would have the executive power to act when there are violations of the quality standards and protocols. We see and read quite often in our newspapers how X private hospital did this towards X number of patients, and basically there doesn't seem to be an executive mechanism, a regulation in place, and also a structure which is beyond the power of the ministers of health and the government and would report directly to the parliament, which would have the executive power to close certain centers or hospitals if there are breach of quality standards and protocols. So we should be able to basically build up that kind of structure, and also that would have to be connected with the accreditation and licensing. Basically, let's say a group of businessmen from some part of the world want to open a diagnostic center or a clinical care center here in this country. They must be able to go through very clear, specific mechanism of quality assessment and protocols to be able that the Kosovo's patients receives good care. And what is the responsibility of our government for us as potential patients? Healthcare, our health is very unpredictable. We never know which one of us and when we will get sick. So we would turn to the government as a responsibility to make sure that we walk in a hospital, that the care given to us is good, is based on the best practices and standards, and our life is not endangered. So the responsibility of the government is to protect us, in particular in the private sector, in the way that our life is not endangered. So how should this quality assessment and monitoring be done in a country like Kosovo? Well, first, the agency should be independent, report directly to the parliament, but at the same time, it should be systematic, leave nothing unchecked in a hospital setting. It should be unpredictable to the agency they monitor so that they don't know when inspectors would come. And at the same time, it should be continuous, not only once a year, but it should be every day of the year, depending on the need. In that way, you, as Kosovo citizens, you will have better care and will be safer in our hospitals. Another thing I wanted to discuss is the capital investments in healthcare. Basically, there hardly has been done any investment in Kosovo's healthcare for the last 25 years or so. And Kosovo's budget is very small. But if we have a very good team in the government, in the hospitals that make project proposals, we could access global funds for prevention, for different tertiary care services. That's what some countries in Africa have done, for example, like Rwanda, like South Africa. And in that way, in a collaboration between our government and our hospitals and global organizations, we would be able to build certain capacities to be able to deliver services at home. And the other very important thing, I believe in a country setting like Kosovo is verification of credentials of healthcare personnel. I remember a few years ago, Ministry of Justice of Bulgaria wrote to our government that there were 9 doctors who had practically purchased their diplomas in Bulgaria. And these doctors were practicing in specialty setting in Kosovo for many years until our government was notified and they basically took back the working license. But why should that happen? Why should it be possible for someone to do such a thing in country setting? Because we don't have a credentialing and verification agency which is able to verify every single credential, medical credential you have got anywhere in the world. That's an obligation of our government, and we should be able to put that in place. While I'm coming close to the end of my talk, I just wanted to say one last thing, that also forensic medicine is extremely important for the quality assessment. Forensic medicine is something that intersects 3 different professions. It's the justice system, the education system, and clinical practice, as well as the clinical care. And, for example, I read in a newspaper when I was in Boston that in a Turkish hospital here, about 221 people died, and out of basically 300 contracted by Ministry of Health, and only 10 autopsies or so were done on those patients who died. What if we have a good forensic service? And the forensic pathologist, after doing an autopsy of the first 5 patients, would conclude that a stenting or recanalization of an artery in the heart was not properly done. There was a rupture. Therefore, the physician who did that is not properly qualified. Perhaps there was be a prevention of other causes. So, in a few words, these are some of the key components that we could work on and access global funds, as well as build up, invest in a critical mass of experts to carry on a reform in Kosovo. In that way, Kosovo would be able to walk in the pathways that countries like Croatia, Estonia, Czech Republic, and Hungary did. They managed to do it. We can do that too. In other words, we should be able to reach out, and a key component in Kosovo's healthcare is lack of political will. We should be able to pressure our politicians, our leaders, that we want cleaner hospitals, better hospitals, and hospitals which perform better, and at the same time, healthcare system be able to provide the needs for the needs that we have. Well, thank you so much for your attention. I'm happy to be able to share this with you. Thank you.